Nursing process for diabetes patient. Assessment. Assess blood glucose values and hemoglobin A1C. والA1C test بيبين لنا how the body manages blood sugar levels. 2. Determine if patient has and is able to use glycometer for pre-meal and bedtime glucose monitoring. 3. Assess for signs and symptoms and for patient knowledge of hyperglycemia and hypoglycemia. 4. Observes patient preparing and injection insulin. 5. Assess knowledge of vascular complication, smoking, and use preventive health measures. Nursing diagnosis. 1. Imbalanced nutrition related to increase in stress hormones, secondary to the primary medical problem, and imbalance in insulin, food, and physical activity. 2. Risk for impaired skin integrity, related to immobility and decreased sensation. 3. Deficient knowledge about diabetes self-care skills, related to new diagnosis, lack of basic diabetes education, or lack of containing in-depth diabetes education. Nursing planning for diabetes patient. The major goals for the patient include improved nutritional state, maintenance of skin integrity, and ability to perform basic diabetes self-care skills, as well as preventive care for the avoidance of chronic complications for diabetes مثل الرينوباثي والنيوروباثي والكدني ديزيز.
النيرسينج انترفنشن نبلش بالأهم وهو النيوتريشن. النيوتريشن is the foundation of diabetes management. Total calories intake is designed to attain or maintain reasonable body weight, control blood glucose level, and normalize lipid levels and blood pressure to prevent heart disease. Calories prescription is based on energy needs, age and size. النسب معينة بتكون كربوهيدرات من 50 to 60%، الفات من 20 to 30%، والباقي بيكون تقريبا 10 to 20% from protein. Fat should be reduced to less than 30% and saturated fats to less than 7% and cholesterol to less than 200 mg per day of total calories. The majority of carbohydrates should come from whole grain, fruits, and vegetables, with sucrose should be limited. The reduce saturated fat and cholesterol intake نحاول يكون المصادر من غير حيوانية of protein مثل legumes and whole grains. Increasing dietary fiber alcohol should be limited to 1 beverage daily for women and 2 for men. ليه؟ لأنه alcohol may cause dangerous hypoglycemia and hyperglycemia and weight gain. Sweeteners may assist with dietary adherence and should be used in moderation. Patients should read food labels evaluating total calories. ثانياً الإكسرسايز. Moderate to vigorous regular exercise is necessary in lowering blood glucose, reducing cardiovascular risk, stress management, and providing a feeling of well-being. Prevent hypoglycemia during exercise by eating a 15-gram carbohydrate or complex carbohydrate and protein snack prior to exercising, at the end of exercise and at bedtime. وعلى المصاب بالدايابيتس undergo medical evaluation before starting an exercise program. A patient should not exercise if blood glucose is over 250 milligram per day and ketones are in the urine.
Glucose monitoring. Self-monitoring of blood glucose عن طريق of diabetics management and prevention long-term complication. كمان ينصح بأنه أعمل من 2 ل 4 time daily, usually before meal and bedtime. All patients, their glucose hypoglycemia or hyperglycemia is suspected. Developing a diabetes teaching plan عن طريق التركيز على knowledge على skill attitudes need to maintain and improve one health. بشرح للمريض simple pathophysiology, treatment modulates, recognition of hyperglycemia, متى يستخدم الأنسولين والبراكتيكال تبع استخدام الأنسولين، وكمان deep containing education envelope تحتوي على information prevention measure avoiding long-term complication such as food care, eye care and risk factor management. Promoting self-care بدي أعمل assess للphysical factors include decreases visual acuity, emotional factors زي الدبريشن اللي بتأثر وبتقلل من patient ability to perform self-care skills، وبدي أعمل assess وأتأكد إنه ما عنده infection أو emotional stress اللي بتعمل elevated للبلد glucose level بالرغم من إنه ملتزم بالتريتمنت ريجيمين. الكونتيننج كير عنا مهمة عشان أعمل managing and preventing للcomplication، وعنا الهوم health nurse بتعمل provide للdiabetics education, wound care, insulin preparation and assistant with the glucose monitoring. عنا كمان منحفزهم على المشاركة في السبورت جروب للبيشنت who had diabetics for many years، وكمان البيشنت اللي عندهم newly diagnosed.
وأخيرا بالنسبة للإيفالويشن، فإحنا بنقيم إذا المريض قادر على الأوبتيمال كنترول أوف بلد جلوكوز، وتكون الريبورت تاعونا بيدلوا على الأبسنس أوف أكيوت كومبليكيشن. برضو لازم نتأكد إنه المريض عم بيعمل maintain للسكين integrity و exhibits understanding of treatment modulates و takes the steps to prevent eye disease و states measure to control risk factor.